Professor Sergei Arkhipov is one of Russia's most well-known traumatologists. At least 30 Olympic champions have been his patients at some points in their careers. 2004 Athens super heavyweight boxing gold medal winner Alexander Povetkin was one who stepped into this doctor's office recently.
I examined him and saw that the ankle joint was swollen, and so was his leg. It's a typical thing for a hemorrhage, both from the outside and inside, where the ligaments were injured. His joint is stable though, which is important, as the two bones that form the ankle joint there are uninjured. The intercrural ligaments are not affected, fortunately for him. What is hurt though is the deltoid ligament. It's a sprain. Not all, but some filaments are torn, which does not cause a full disruption of the anatomic structure.
29-year-old Povetkin's impressive run to the IBF title fight has earned him not one but two nicknames. Abroad he is known as the White Lion, while home fans call him the Russian Knight. He became his country's first ever Olympic super heavyweight champion 4 years ago. The Kursk native turned pro since then, and his record to date is 16 wins, no losses. 12 of those bouts being won by knockout. December 13, 2008 was supposed to be one of the biggest nights of his career, but the ankle setback has delayed his mandatory title fight against double world champion Vladimir Klitschko.
The clinical symptoms were obvious, so I examined him, diagnosed and recommended not surgery, but an up-to-date bone splint. It doesn't hinder him much, but for about 4 weeks he'll undergo rehabilitation, including physiotherapy, hot applications, medications and electrical treatment.
Povetkin has said on several occasions that his goal is to end the Klitschko hegemony in pro boxing, especially when the Ukrainian is at the top of his game. But at this point, it looks as if it will be at least another 6 months until he gets the chance to try and do just that. Professor Sergei Arkhipov has treated star athletes for over 28 years now. The injury that Alexander Povetkin has sustained is not unusual in sports, and the doctor is convinced that the Russian Knight should be back in regular training very soon. Roman Kosarev,